Okay, sir. Shall we begin, sir?
Yes, we do.
Okay, sir. I'm handing over the session to Soumya.
Good evening, everyone. The future belongs to those who believe in the beauty of their dreams. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for Dr. Sudhirajan N. Memorial free webinar series organized by DIKSHA E-Learning in association with Ayurveda College Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discuss about Madatyaya management by Dr. Vinay Shankar sir.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class sessions, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised in the chat box. Questions raised will be cleared at the end of the session. Next, I would like to invite Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am.
Good evening, one and all. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, I take this honor to welcome Dr. Vinay Shankar sir in today's session. A warm welcome to all the participants who have gathered in today's session. Hope this class will be really beneficial for you. Thank you.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Vinay Shankar sir. Vinay Shankar sir completed his UG and PG from SDM College of Ayurveda, Hassan, Karnataka. Later on, he joined in Nagarjuna Treatment Center. Then he has worked as the Special Medical Officer for Mental Health Disorder at Thrissur District Hospital under the ISM department for a period of 3 years. From 2019, Sir is working as an Assistant Professor, Department of Manovignana Evam Manasa Roga in DSM College of Ayurveda, Hassan, Karnataka. We are extremely obliged to have you here, sir.
Thank you.
Now, without any further ado, let me hand over the session to respected Dr. Vinay Shankar sir to enlighten our mind with his knowledge. Over to you, sir.
Thank you very much. Thank you very much, all. Thank you, DIKSHA E-Learning, and thank you, Tulya ma'am, for this warm welcome. And once of all, I would like to thank the DIKSHA E-Learning for giving me an opportunity for expressing my views regarding what is Madatyaya, what I have experienced in these 7 years of my practice. It is very minimal that it is a very short duration of time as an Ayurvedic psychiatrist, understanding a psychiatric condition or a Madatyaya is very short time, but still whatever knowledge, whatever experience I have gained and what I have understood about Madatyaya as well as what treatment protocol I am following or what we are following here, what all aspects of Madatyaya we are dealing here, that will be the matter that I explain here today. First of all, I would like to tell you that in today's topic, I'll be discussing regarding Madatyaya in alcohol use disorders. As such, Madatyaya means it includes all addictions, not only alcohol addictions, any kind of addictions that can be included under Madatyaya. Because the term Madatyaya have two terminologies, that is Mada and Atya. Anything that causes excessive excitement, that is Madatyaya. Anything that causes excessive excitement, that is Madatyaya. Nowadays, there are a lot of addictions seen in the society. For example, is mobile addictions, then drug addictions, all those things. When coming to Ayurvedic point of view, there are no separate descriptions or explanation regarding different types of addiction. All these addictions have been compiled together under the heading of Madatyaya. So today, I would like to explain about what is alcohol use disorders. What are the different stages of alcohol use disorders and how we can understand at which stage the patient is and how we can manage it in our OP or IP sections. I will not go for any kind of slokas or anything. Strictly, it will be a practical oriented class. And next thing is that I would like to start with the introductory aspect. That is, what is the very few 2 slides of introduction. What is Madhya and what is Madatyaya? So in Ayurvedic Samhita, Madhya is explained under one of the 12 Ahara Vargas. It is used as Ahara Dravya and as Anupana and even as an Aushati. In Sushruta Samhita, there is even references of Madatyaya used as Sanyaharana, that is anesthetic during surgeries. On the basis of use, Madatyaya is classified into 2 aspects. One is as Aushadha, other is as an beverage. It is further classified into 5 types depending on methods and raw materials used. For example, Asava, Arishta, that comes under Aushadha, Sura, Varuni and Sidhu, that can be considered as beverages. Next, coming to the point, what is Madatyaya? Here, specifically, as I'm concentrating on alcohol use disorders, I'll be explaining about Madhya. Madhya is an alcoholic beverage, is one which produces Mada or excitement. When consumed with proper rules about quantity, time, and procedure, it gives happiness, strength, reduces fear, strain, and act as nectar. But at the same time, when consumed without the following the rules, it results in Madatyaya. Next, as I explained priorly, what is Madatyaya? Madatyaya comprises of 2 words, Mada and Atyaya. Mada means excitement. Atyaya means excess. Excess of excitement. Whatever aspect which lead to excess of excitement, that leads to Madatyaya. In this condition, in this aspect, what I explained, today I will be taking up Madhya as the component which causes excessive excitement. Next, what is addiction? Generally, it is meant an inability to stop doing or using something, or compulsive psychological need for and use of a habit-forming substance. This is very important. Habit-forming substance. Whatever substance which is causing makes as a habit, that comes under addiction. Next aspect, next slide, please. Next slide. How addiction happens. What happens in our brain, or what leads to addictions? The chemical compounds in the addictives. So whatever compound is there in the Madhya, when it enters the bloodstream and brain on prolonged use, then it does an alternation in the mesolimbic dopamine pathway or reward circuit, you will say. Here, to understand reward circuit, what is that? Whichever thing or whichever act which gives us pleasure, that is controlled by the reward circuit. So this is very important when coming to understand how addiction happens. There is an alternation or alteration in the mesolimbic dopamine pathway, that is reward circuit, which begins in the ventral tegmental area above the brainstem. This increases the production of dopamine, leading to feeling of pleasure, which motivates to repeat the behavior. So this is very important. When the dopamine level is increased, then the person start to feel pleasure, which motivates the person to consume the substance. That in this point, it is Madhya, repeatedly. So that is the craving of substance leading to addiction. Once a person becomes addicted, the brain receptors become overwhelmed. Here what happens, it is that when there is a dopamine, increased production of dopamine. But once the patient is addicted, the brain receptors become overwhelmed and the brain started to respond by producing less dopamine or eliminating dopamine receptors. That means it is used to say that from pleasure point of view, it has become a habit. From a pleasure point of view, it has become a habit. It is not only in this case of Madhya. If you take mobile addictions or drug addiction, first it starts as a pleasure point of view. Gradually what happens, it goes to such an extent that the patient or the person is not able to control his affection towards the substance. At that time, what happens? The brain ceases or produces less dopamine or eliminates the dopamine receptors. Next slide, please. Next slide. Next, coming to today's main topic, that is Madatyaya and alcohol use disorders. Ayurveda explains varieties of disorders that are caused by the improper usage of alcohol. These disorders are grouped under the heading of Madatyaya. The term Madatyaya is not just an alcohol intoxication, dependence, or withdrawal. These points I'll explain later, but it's a condition where multiple system dysfunctions are involved, from immediate and acute manifestation to chronic and severe manifestation. Mainly, when coming to the somatic point of view, there is neurological, gastrohepatic, and cardiopulmonary manifestation, which are the commonest among the alcohol use disorders. Next, coming to alcohol use disorder. Alcohol use disorder is a pattern of alcohol use. When this point I would like to highlight is that when we can consider a patient is coming under the category of alcohol use disorder. So these are the things that we must notice. What I have noticed in my practicing career, these are the factors that I have noticed to bring the patient under alcohol use disorder. That is the pattern of alcohol use. That is problem controlling your drinking, being preoccupied with alcohol. That means today morning, if I don't take alcohol, I cannot do any activities. Or if I don't take alcohol, there is shivering. It affects shivering. That is preoccupied thought towards alcohol. Or without taking alcohol, I cannot sleep. Or without taking alcohol, I cannot do any of my activities. These are the preoccupied thoughts related to alcohol. Another preoccupied thought is that nothing will happen to me. After consumption of alcohol, I am eating enough quantity of food. Nothing will happen to me. That is another preoccupied thought. Another thing is it's a social phobia. For example, my father or my family members are drinking. It is a matter of pride that I must drink alcohol. These all are the preoccupied thoughts regarding the alcohol consumption. Next point is continuing to use alcohol even when it causes problems. For example, in 90%, you can say 90% of the alcohol use disorders, the patient is aware of the health problems caused due to alcohol. But still, due to the excessive affection towards the substance, the patient is not able to quit alcohol. Okay, then next is having to drink more to get the same effect. That means every person or every item that is getting addicted, those substances start from a minor dose. As the days progress, as the consumption days progresses, the intake or the usage must be increased to get the same effect, or you will say same effect or same pleasure. For example, today I take I will tell in smoking, you'll understand more easily. That is, first you took one puff today, you are happy, you are relieved of your stress. Tomorrow you will have half cigarette. When you have more stress, next day it becomes one cigarette. Gradually it becomes one packet. But the stress level is the same, but your pleasure as well as the stress maintenance aspect is changing. That means you are getting more dependent to smoking or alcohol than managing your stress conditions. That is having to drink more to get the same effect. Next is having withdrawal symptoms when you rapidly decreases or stop drinking. If the patient is having withdrawal symptoms, what are the withdrawal symptoms? I'll explain later on. Or rapidly, that is in between when the patient feel that I must stop alcohol and suddenly they abruptly stop consumption of alcohol. That can lead to other psychological as well as physical symptoms, again provoking the patient to continue intake of alcohol. Next point, please. Alcohol use disorders include periods of alcohol intoxication. Alcohol use disorders can include periods of alcohol intoxication. Next, I will be explaining about alcohol intoxication, alcohol withdrawal, as well as alcohol dependence. These are the three different stages of alcoholism. Okay, under this alcoholic use disorder. Alcohol intoxication occurs when a person drinks an excess of alcohol in one period. Generally, in my OPD, the patients, 40% of the patients come to my OPD with acute intoxication. That means they show us a complaint of consuming alcohol throughout the day for 1 week or more, without consumption of any food, without sleeping, no proper any of our daily routines might not be there. And at the point when the patient is brought by to our OPD, or the patient is coming to our OPD, there will be the presence of vomiting, then excessive debilitateness, then tiredness or giddiness, all those features. Whatever, even the patient drinks water also, it start to vomit. So that is the stage in which alcohol intoxication. That is when a person drinks an excessive quantity of alcohol. What happens is that patient may take more than 750 ml of alcohol in a day for more than 7 days. That can lead to acute intoxication. Next point is alcohol intoxication result as an amount of alcohol in your bloodstream increases. The higher the blood alcohol concentration is, the more impaired you become. Alcohol intoxication causes behavioral problems. Mainly, I have seen in my OPD, the behavioral problems is non-cooperativeness to the family members, or not at all going to any kind of work. They generally become a familial burden or a social burden. Then only they are brought to us for the treatment. As per Ayurveda, alcohol, the 3 stages of Madatyaya, I include it under alcohol intoxication state. That is Prathama Mada, that is the first stage, Ditiya Mada, second stage, and Tritiya Mada, third stage. Where in this Tritiya Mada stage, 90% of the cases, intoxicated cases, comes to my OPD in the Tritiya Mada state. Whether the patient will be in a semi-conscious state or completely debilitated, maybe on a wheelchair or even on a stretcher. That stage, they come to our OPD. Even I get Prathama Mada or Ditiya Mada patients. They're also there, but generally we get as a Tritiya Mada stage. Next point. Now this is regarding the alcohol intoxicated state. Okay, next I would like to discuss about alcohol withdrawal. Alcohol withdrawal can occur when alcohol use has been heavy and prolonged and is then stopped or greatly reduced. It can occur within several hours to 4 or 5 days later. So what is alcohol withdrawal? Alcohol withdrawal doesn't happen. It is not compulsory that every Madatyaya patient or every patient with alcohol use disorders must have alcohol withdrawal. But in around 25 to 30% or 35% of the patients may face a problem of alcohol withdrawal. That alcohol generally this alcohol withdrawal is seen in the patient which is brought to us in an intoxicated state. When the patient is brought to us in an intoxicated state and we admit the patient, then the next few hours or to the next 3 to 4 days when they are under our observation, there are chances of alcohol withdrawal. Because if they are in their home, there have been tendency to reconsume the alcohol. So the withdrawal will not be highlighted. In alcohol withdrawal, the signs and symptoms will be both somatic as well as psychological. Next point is, what is alcohol withdrawal timeline? And what are the diseases or what are the symptoms that you can see during this timeline? Okay, this is from the point, the time we must consider is when he took the last drink. Where the patient might have been brought to us when he took alcohol in the 8 a.m. in the morning, and patient is being brought to us in 3 p.m. in the afternoon. So the time it starts is the 8 a.m. That is the last drink time. From there, you must calculate the withdrawal timeline. That is stage 1. That is, it happens in 8 hours. That is from 8 a.m. in the morning. Next 8 hours is the stage 1, where the patient will have anxiety, insomnia, nausea, and abdominal pain. As I told earlier, when in alcohol intoxicated state, patient will feel abdominal pain or nausea or vomiting sensation. That all happens in the first 8 hours of alcohol withdrawal. Next is stage 2. Here, what happens? Fever and chills. There are chances of seizures, high blood pressure, and increased food temperature. Increased food, not only body temperature, especially food temperature. That is 1 day to 3 days. That is stage 2. Next comes stage 3. That is 1 week. That is after 6 to 7 days of complete cessation or complete abstinence of alcohol. There is stage 3, where the patient will be speaking irrelevantly. Sometimes the patient will be howling, or patient will have severe seizures, episodes of seizures, as there is a craving of alcohol or the dopamine receptors craving increases. There are chances for seizures, and even the patient can become agitated. And the other one thing we must note that it is not restricted to these 1 week. If there is no proper line of treatment given to the patient, these alcohol withdrawal symptoms can be prolonged up to weeks and even months if it is not treated properly. For example, when this happens, there is a general mythology or a mythological aspect that you have, ghost as entered the, family member, or something Devapashra line of aspect. And they have a tendency to get the patient to more of this Devapashra line of treatment. At that time, when they are the treatment is not given properly, proper attention is not given to the patient, these symptoms of hallucination, seizures, and aggression can withstand for more than 2 months. That is, until the last drop of alcohol in the bloodstream is gone, these withdrawal symptoms can stand back. Okay. The next point is alcohol. This is regarding alcohol withdrawal. Okay, next point is alcohol dependence. According to DSM-4, there is another point, that is alcohol dependence. This is the most number of cases which we get in our OPD. Most number of cases which we get in our OPD is of alcohol dependence. That is, dependence means, according to DSM-4, at least 3 out of 7 these criteria must be met, and it must be for duration of 12 months of a period. I'll tell you these 7 criteria. At least 3 out of it must be met for 12 months of a period. That means out of these 7, 3 criteria must be seen in the patient for 12 months duration. First point is tolerance level. Tolerance level. That means until he just, what you'll say, go to an unconscious state, what is his maximum capacity of intake? That is tolerance level of alcohol. What is the maximum capacity? That means, for example, some patients comes to us with the maximum capacity of just 180 ml. That is 1/4 of alcohol. Some patients even come to us with 3 bottles. That is 750 into 3 bottles in a day. So that is a tolerance level. So we must assess the tolerance level of the patient. For that, we ask is that what is the maximum quantity that you take? What is the maximum quantity until you are conscious? Until you are conscious, that is tolerance level. Next is any kind of withdrawal symptoms, clinically defined alcohol withdrawal syndrome. Any symptoms of that is there, or use in larger amounts for a prolonged period of time than intended. That is one of the criteria we generally see in alcohol dependence cases. In my OPD, I get patients who have started drinking from the age of 16, and now the age the patient comes to our OPD is around 40. So he will be consuming alcohol for almost 20-25 years of time. At starting of time, the amount will be very minimal. But as the age progresses, as the duration progresses, there will be larger amount. At a point, it comes that there will be a saturation of the quantity. Saturation of the quantity. That means around half bottle or 1 bottle, they stand in that half bottle, 1 bottle quantity for a 2 to 5 years of period. That is a prolonged duration. Same amount, and there will be a prolonged duration. When that starts to give less happiness, then they increase the quantity. That is a point in using larger amounts or for a longer periods than intended. Next is persistent desire or unsuccessful effort to cut down. That means even though the patient is willing to cut down or even have tried for abstinence, due to different alcohol withdrawal symptoms or due to peer pressure, they will not be able to cut down its effect or cut down its uses, not effect, cut down its uses. That is persistent desire or unsuccessful efforts to cut down. Then time spent obtaining alcohol or recovering from its effects. That is very important. Time spent in obtaining alcohol. That means 90%, you can say not 90%, 100% of the alcoholics or Madatyaya people who comes to our OPD will spend maximum of their time in a day to obtain alcohol. They work only to drink alcohol. And the recovery time is that time they sleep or they are unconscious. Okay, then social, occupational, and recreational pursuits are given up or reduced because of alcohol use. Obviously, any patient with alcohol use disorder or a chronic addict, they will have, they will have reduced or given up in social, occupational, recreational activity. Then only it is called as addiction. Obviously, when this patient comes, they'll be away from the society, away from their occupation, and even away from their familial aspects. The last point is use is continued despite the knowledge of alcohol-related harm. All addicts knows that alcohol is harmful. Very few of them regret it. Still, they continue to take. Majority of them doesn't regret it, even though they know the harmful effect of the alcohol consumption. So these are the 7 criteria. Once again, I'll tell you: tolerance, withdrawal symptoms, use in larger amounts for a prolonged period of time, persistent desire or unsuccessful efforts to cut down, time spent in obtaining alcohol and recovering from alcohol, social, occupational, and recreational pursuits are given up or reduced because of alcohol use, and use is continued despite the knowledge of alcohol-related harm. Among these 7, any 3 is present in the patient for more than 12 months of time or 1 year of time, then he comes under the category of alcohol dependence according to DSM-4. Okay. Next, coming to what are the risk factors of alcohol use disorder. Okay, alcohol use disorder may begin in teenage, but alcohol use may begin in the teenage, but alcohol disorders occurs more frequently in the 20s and early 40s. Though it can be found that it can start at any age of time. So what what is the pattern that generally I have seen that I have highlighted here? Steady drinking. In alcohol use disorders, I have seen people with steady drinking. A particular amount will be there. As I told earlier, a particular, they have reached a saturation level of 2 quarters or 3 quarters, that is 3 into 180 ml. And they will be consuming the same quantity for a prolonged period of time. And there are chances of starting at an early age. Then there will be familial history. Any members of the family. This family also includes the brothers or the friends. Can be included under family history of alcohol consumption. Then social and cultural factors. So there are certain cultural aspects also which can lead to addiction, because there are certain ceremonies which promotes consumption of alcohol in the early ages that can lead to addiction. Next is depression and other mental health problems. These depression and other mental health problems can also lead to alcohol addiction. Next, coming to the point, what is the impact of alcohol use in our body? Drinking too much of alcohol on a single occasion or time can cause health problems, including liver diseases, digestive problems. Everybody, as all our doctors, you might be knowing all these problems: digestive problems, heart problems, diabetic complications, sexual dysfunctions, menstrual issues, and even eye problems. Next is all these points you might be knowing. Even in theoretically, you might have read about it. So I'm not explaining it in detail. So these are the other points. Alcohol, what you will say, impact on health, birth defects, bone damage, neurological complication, weakened immune system, medication and alcohol interactions. That is very important point. Medication and alcohol interaction. There is one more thing I would like to bring to your notice, that there is another kind of addiction which is related to Madatyaya, but it is not drug, but not any kind of drugs or anything, but addiction towards medication. That is also very important point. In Madatyaya, that also is included. Addiction towards medication. For example, cough syrups. Nowadays, it is very common that cough syrups have as a substance for addiction. For example, Codex syrup. I had a patient, I would like to share this point. I had a patient 3 or 4 years back. I had a patient who consumes 4 bottles of Codex cough syrup in a day. 4 bottles. 4 bottles of it is very dangerous. Codex cough syrup is banned in India. And this is contain very gross chemical contents and steroids. It causes addiction. So even that can be considered under Madatyaya. And here I would like to say is medication and alcohol interaction is drug reaction when if you're taking some tablets and you consume alcohol over it, then it can cause interactions or reaction causing other somatic or psychological diseases. Next, I would like to bring to your notice how to take a history or an alcohol intake history. When a patient comes to your OPD, what are the points that you must consider so as to understand whether the patient is in an intoxicated state, whether the patient is in a dependent state, or whether the patient is in a withdrawal state. This is a very important factor. It is very easily misjudged between the different states of alcoholism. It is very important to understand different states of alcoholism because the treatment pattern also changes from different stages. Actually, as per my observation, what I have seen and what I do, I generally don't go for Prathamada, Dvitiyamada, Tritiyamada line of treatment. Instead, I go for alcohol what all treatment we give for alcohol intoxicated state, while what all treatment we go for alcohol withdrawal state, and what all we do for alcohol dependent state. That is a more approachable way or more practical way to approach Madatyaya. So how to take history? What are the points that you must consider while you're taking history in case of alcohol use disorders? First and foremost point, alcohol intake history. Alcohol intake history, it is very important. There are a lot of questionnaires also has been used to understand the alcohol intake history. That is one is Cage questionnaire. Cage questionnaire is there. Then there's Audit C questionnaire. Cage questionnaire have very minimal of 4 questions where you or asking the patient about whether you feel guilty, or that I'll explain later on. As it goes, I'll explain. First of all, in alcohol intake history, first point to cover is frequency. How often do you drink any alcohol? Here, any alcohol, what I meant is that any kind of beverages, how often you drink. That is every day, once in a month, once in a week, or twice in a day. What is the frequency of that you drink? Okay, under what circumstances you drink? When you are stressed or anxious? Only on special occasions? Or that is what you say, what social drinkers, whether you are a social drinker or you are an addict. That is the point. Under what circumstances? Generally, the patient starts with, I started drinking when I was stressed. Then I became anxious about drinking. Then I got addicted to the drinking. That is a pattern what I have observed. Under what circumstances? Means we get all these aspects. Or you can say that I started with my friends or peer pressure. Okay. Or I started in a wedding or I started in a birthday party. Then when I got stressed, again, I started to consume. Then I became anxious about what will if I take more and more alcohol. Then I became an addict. That is a pattern that generally what I have seen when we ask about under what circumstances you have started drinking. Next point is how old were you when you started drinking. That is onset period. At what age you have started. This is to understand the dependence level of the patient. Dependence level of the patient. That is the last point. How old were you when you start drinking? How much dependent you are on this substance, that is the alcohol. That is that point. Next is location. Where do you usually drink? Whether it is in a bar or it is in a parties or at home. Generally, what I have to understand is how is his social acceptance? What, or you can say, how is his social behavior? Whether he is an introvert personality, whether he is an extrovert personality, whether he is having any friends during, whether he is drinking in a social circle. All these is understood by this point. Where do you usually drink? Whether it is in a bar or at parties or at home. Where what I understand, if it is in a bar, there will be usually peer pressure will be there. At least the daily barmaids will be there for people. So at least that social mingling or social intelligence will be there. At parties means they can be, what do you say, occasional drinkers or social drinkers. At home means it is a bit more dangerous because there are chances of consuming more alcohol when you are alone. There are chances of consuming more alcohol when you are alone. Okay, that is a very common pattern, or the prevalence rate, which I have seen in an article, says that when you are alone, if you are consuming alcohol as single, there are more chances of, means increase in the quantity of consumption. That can even lead to, what do you say, aggression, increased aggression in the patient if he is consuming in the home. So that is, the location also is very important when you take history, alcohol intake history. Next point is, what do you usually drink? This is also very important. What do you usually drink? Whether you drink wine, beer, spirit. This is to understand what is the ethanol content inside the drink that he uses. Most potent among the alcohol is rum, which contains 48% of the ethanol. Next is, I think, actually the most highest, what do you say, quantity of alcohol content is in absinthe. Absinthe. It is an absinthe. Have you heard about this drink? I don't know. It is a green color drink. Generally, we get in outside the country. It contains 98% of alcohol, 98% of ethanol in it. Okay. Then it comes rum, whiskey, brandy, beer, all those categories. This is a quantity of ethanol inside the drink. That is very important. To understand that, we ask the question, what do you usually drink? Next question, how much do you usually drink? How much do you usually drink? Most day. Attempt in ml, bottle, count, or liters. That means, what is your stable, or what do you say, saturated level? That is a question that stands for how much do you drink? That means whether you take 180 ml in a day, 750 ml in a day. If you count like that, how much you take. Otherwise, how many bottles of alcohol? For example, beer, we generally can't calculate in bottles. So how much bottles? Even certain alcohol contents are available in liters. So how much liter of alcohol you consume in a day? Okay. Next question, what is the most you might ever drink at any one time? That is, what is your maximum capacity? Until you are conscious, how much is the maximum that you have taken? On 20-25% of time, the patient will be unconscious after intake of alcohol. So until you are conscious, what was the quantity you have taken? That is this threshold level or tolerance level. Next question, how much do you usually spend on alcohol in a week? How much do you usually spend on alcohol in a week? This is very important. Last question is very important so as to counsel the patient. That last question, how much do you usually spend on alcohol in a week? That is to understand and use it against the patient. That I'll explain to you later on. Okay. So next point, please. Next slide. The patient should be asked if alcohol drinking has had any adverse effect upon his own work, particularly whether it is affecting his occupational status, whether you are going for work. Have you ever missed work because of your drinking? For example, there is a condition known as Monday morning absenteeism, where Sunday night, as it is a holiday, they drink up to their maximum and they miss the first session of their work or even the whole day of Monday. They miss. That is Monday morning absenteeism. Okay, that is one aspect. Next is, do you think the quality of your work has ever suffered because of your drinking? That is, whether your productivity has decreased. Whether your productivity have decreased due to drinking, or the income that you have generated before starting off alcohol consumption, compare it with the present situation of alcohol during addiction time. So you can understand whether there is an increase or decrease in the quality of work. Have any of your colleagues or supervisors ever commented on your drinking? This can be changed into any aspect. If the patient is an agriculturist, they don't have colleagues, they don't have supervisors. So you can take it to other aspect is that have any one of your family members or any one of your friends has commented bad, negative about your drinking. That point can be converted in such a way. So these are the points while you're intaking the history of the alcohol consumption history of the patient. Next aspect is, along with this, you must also ask about familial history, whether there is any family influence is there, whether there is any problem of disorganized family or stressful work situations or any kind of financial or occupational crisis for the patient that is leading for alcoholism. That also must be identified, because that point is very useful while we are doing counseling of the patient. All this aspect while explaining about counseling, I'll tell you. Okay, next point is that social effect of drinking. Here comes the 4-question CAGE questionnaire. As I explained priorly, CAGE questionnaire, the 4 questions of CAGE test provide a useful and rapid screening for the adverse social effects of drinking. CAGE is an acronym for concern, anger, guilt, and eye-opener. If there is more than 2 points among these 4, you can go for next stage, that is audit C stage of screening of the patient. First question, C stands for concern. Are you concerned about your drinking? Generally, they say no. Generally, the patient comments that they are not at all concerned about their drinking. Next question, do you get angry even if anyone criticizes your drinking? 100% of them get angry when anyone criticizes on their drinking habit. Next, do you feel guilty about your drinking? In my experience, 30% of the people feel guilty, but still they are not ready to quit. Next 30% does not feel guilty. Next 30% they get annoyed when they say about their drinking. Next, do you ever take eye opener? Eye opener, that is very important. As soon as eye opener means, as soon as you wake up, even before brushing your teeth, first thing you do is intake of alcohol. There are certain people says that if you don't take early morning, I'll not be able to do work. There'll be shivering in my hands. So that is the reason I take early morning. That is, before even brushing of your teeth, they consume alcohol. That is eye opener. If you have any 2 to 3 positive in this, then you must go for the next stage, that is audit C. Audit C is a huge questionnaire. To explain that, it is very difficult. For In this session, audit C only will take around 2 hours to as a class. So it will be very difficult. General questions is, what is the maximum quantity you take? When did you start? Or how did you start? What is the maximum quantity? That is 8 pegs. That in pegs they can calculate in audit C. Whether you have tried to stop any time, whether there is any period of abstinence from alcohol. All these comes under audit C questionnaire, AUDIT, audit C questionnaire to assess the alcohol impact on human body. Next, coming to the point, these are regarding the history point of Madatyaya. Next point is treatment. It is very important. Next point is treatment. Working to stop the use of alcohol to improve the quality of life is the main aim of our treatment. This is our treatment, what we do here. Treatment for alcohol use disorders can vary depending on needs of patient party, as well as the social aspect. Treatment may involve a brief intervention, individual or group counseling, an outpatient program, or even a residential inpatient stay program. Generally, 90% of the cases we require inpatient stay so as to help the patient quit alcohol consumption. In case of mild alcoholic disorders, recent addiction, that is 1 week to few months, if the patient is willing for the addiction through self-control and abstinence, we can plan for outpatient department treatment. But in 70% of the cases, the patient will be brought to the consultation. That is, the patient will not be willing to quit alcohol by themselves. In that case, patient must undergo inpatient treatment. Next point. Inpatient department we can plan treatment for different duration based on severity of alcohol disorders as well as state of alcohol addiction. This both point must be taken into consideration when we plan the treatment, both alcohol disorders as well as state of alcohol addiction. First we must consider the state of alcohol addiction, in which state he is brought into our OP. That is whether it is in an intoxicated state, whether it is in a withdrawal state, or whether it is in a dependent state. And next thing, first is this aspect must be considered. Next point must be what all somatic impact it has happened, the alcohol consumption, what all somatic impact has happened to the patient, what all treatment that you can do for that. That is also very important. That must go hand in hand. That is both psychological aspect as well as the physical or somatic aspect must go hand in hand when you do alcohol addiction treatment. We can plan for 7 days line of treatment, 15 days and 28 days. There is no, what will say, I'm not restricting anybody to go for 7 days, 15 days or 28 days. As per your yukti, as per your plan, you can plan the treatment seeing the patient. Okay, this is what I follow in my OPD and my hospital. That is, we plan here for 7 days, 15 days and 20 days of treatment plan. We here follow a definite treatment protocol while treating Madhya's cases in our hospital. Next slide, please. Next, I would like to say about what all kind of treatment, what all medications that we give in different stages. If the patient is coming in intoxicated state, we go for Kharjuradi Manda, then go for Draksharishta or Srikanthasva, Manasamitravati. Why I'll explain one by one. Kamaduga with Mukta and Eshtimudu Shirvaka. See, Kharjuradi Manda is one drug which is very important or very good in treating Madatyaya because it is having almost a similar taste and similar features as that of Madhya. So we can convince the patient to take Kharjuradi Manda easily when compared to any other drugs. Okay, that is the intent. Kharjuradi Manda is very good for our appetite. Mainly the appetite will be altered in the patient. It is very good, easy to digest. It is very good. Okay. Generally, one more thing I would like to bring to your notice that as soon as if the patient is coming in too much debilitated state, it is very difficult. Even they say give the complaint of vomiting. As soon as if you intake water also vomit. If you smell something also, in that case, even we can go for 2 to 3 days of DNSRL. Okay, saline solutions for supplements for 2 to 3 days so that to stabilize the patient's health. Until unless we stabilize the patient's health, it is very difficult to manage the situation. Only with oral medications or by Takradara, it will be difficult. In case of intoxicated and in withdrawal stage, it is very important. In case of dependent stage, we can manage it very easily. But coming to intoxicated state as well as in withdrawal state, you can plan for what supplements or DNS solution for 1 to 2 days, so that to stabilize the health of the patient. Okay, then you can go for Karjuradimanda. Draksharista, that is to regain the strength for the patient. Manas Mitravati to calm his mind, induce sleep, everything. Kamaduga with Mukta, that is to provide gastric support. When you suddenly induce such medications after, or if the patient is having not intake of food or liquids, normal liquids for more than 1 week, that is an intoxicated state. Generally, we get in such a way that patient might not be taking food for almost 1 week or reduced intake of food. That can cause gastric irritation. To pacify that, we go for Kamaduga with Mukta. Eshtimoduk Shirapaka, that is another concept which we have started to practice in the last 1 year, where we have got a good result in restricting the patient from cravings, restricting the cravings of the patient. Eshtimoduk Shirapaka. And we can use both in a Shirapaka form as well as in Eshtimadu Churna can be given 5 grams BD with milk to reduce cravings in the patient towards alcohol. Okay. Next, what will the Panchakarma treatment generally that we can do? That is in intoxicated state. Generally, Panchakarma treatment is very difficult. If the patient is manageable, if he is not too much debilitated, you can, if the patient is having good strength, physical strength, and mental power or willpower, then some patients comes to our OPD, they'll be intoxicated state, they'll be good in physical state as well as mental state, that I am ready to quit alcohol. In that cases, you can go for Sadhyavamana with Eshtimadu Fanta and Saindavachala. Then 90% of the cases, intoxicated case, they will 100% on the day of admission. After 1 day of admission, they will feel the problem of insomnia. So to promote, because they are not consuming alcohol for more than 12 hours, that means there will be insomnia in the patient. To promote sleep, you can give for Shirobichu with Brahmi Tela or even Shirabala Tela can be administered to the patient. Next point is what we do when the patient is in a withdrawal state. Withdrawal state. Here, 2-3 things we must consider when you are treating, if the patient is in withdrawal state, before starting of any medication. What is the present situation of the patient? What is the present situation of the patient? Am I audible? Am I audible to all?
Yes, sir.
Okay, fine.
Yes.
So we are in withdrawal state. One thing we must consider is that at what stage the patient is brought to us, whether it is in the first 8 hours of withdrawal, or whether it's in the stage 2 of withdrawal, or whether it is in the stage 3 of withdrawal. That is because to convince the patient to undergo treatment is very difficult. To convince the patient, generally in Ayurvedic hospitals or in Ayurvedic facilities, we don't have, very rarely, I have seen only in Kottagal Ayurveda, this one, or not Kottagal, the Government Ayurveda Research Institute for Mental Health, Kottagal. Only they have the cell facilities. If you want to attain the patient forcefully, there are provisions of cell facilities in de-addiction centers. Even chained facilities are there. Patient will be chained, so that the patient must not be forced. But when in general Ayurvedic facilities or general Ayurvedic hospital, we don't have such facilities. So before taking in the patient or before admitting the patient, you must be very clear that whether the patient is manageable, whether the situation of the patient is manageable in our available facility. So that whether the patient is in the stage 1, stage 2, or stage 3 is very important. If the patient is in a stage 3, for example, aggression, hallucinations, or insomnia, in that condition, if you want, you can go for sedatives. If at all you have the provisions, you can go for sedatives for 8 hours, 8 hourly for 1 day, 8 hourly for 1 day. As soon as the patient is sedated for 1 day, gradually the second day, the aggression will be reduced, hallucination, patient will get a good sleep, the hallucination will get automatically reduced. After seeing this condition only, we must intake the patient or we must start with any kind of oral medications. So in that conditions, you can give for oral medications is Musta Churna or Panchakola Fanta. This is to improve the appetite. Next, another one is Gutagrita. This is also one of our college. They have started using this since past 3 years. The Gutta and Grita is made into paste and 1 teaspoon is given, 4 to 5 times in a day. This helps to reduce the craving as well as reduce the withdrawal symptoms in the patient, like hallucination. There are, good progress or good result which we have got in Gutta Grita, where the patient, there are less withdrawal symptoms seen in the patient. Next is, as usual, I told Karjuradi Manta. Here we can go for Shrigandasava. A little bit more higher quantity, what you'll say, liver tonics, then Marsamitravati and Sarasa Arista to pacify the patient psychologically, then Estimati Shirapaka twice a day to reduce the craving. So Panchakarma treatment, generally what we can follow, that is Takradhara can be given. These all the Panchakarma treatments you can only do after 2 to 3 days of admission. Minimum 2 days of admission, because you must observe the patient whether the patient is cooperative enough to you. Then only you must take the patient, then only you must advise the Panchakarma treatment, because if the patient is non-cooperating and patient is in an aggressive state, patient will not cooperate to do any kind of these Panchakarma treatments. So once you pacify the aggression first, let the patient adjust to the environment which is brought to by, because as an entirely different person, when, for example, I would like to do anybody who goes to a hospital for admission, first 2 days, there will be a reduced sleep problem. First 2 days, there will be a reduced or insomnia problem. That is the patient or the person is getting adjusted to the environment. Same is for the alcoholic addict. When he is brought to by from his usual comfort zone and he is brought to a new situation, there will be aggressive episodes. So first you must give time for him to settle in. Then you can go for Panchakarma treatment. Okay, so after these 2 days, you can go for Takradhara, Abhyanga and Dhanyamla Parisheka. After you can go for another one point is that for 3 days, after this pacification, after this balance, for 3 days, you can go for Udvartana and Pariseka, Dhanyamla Pariseka as a Rukshana line of treatment. Then you can go, along with that, you can go for Takradhara to induce the sleep. Then we can start with, depending upon the seeing the appetite of the patient. Along with this, you can give what you will say, Deepanavachana drug. It is very important to provide Deepanavachana drug with along these treatment, so that's to improve the appetite. Once the appetite has come to improved, not come to normal, improved, you can start with Snehapana, preferably Kalyana Grita or Morsha Grita. Even Tailapana in certain situations, Tailapana can also be taken. Okay, then generally we prefer for Vamana, but if the patient is not what you will say, comfortable with Vamana, generally alcohol addicts, they don't be comfortable with Vamana because they have a phobia towards Vamana, because they might have done different times, vomiting might have been done by the patient, but induced vomiting is a bit difficult for them. So generally we go for Virechana, Shiropichu with any Kshirabala or Brahmi Tela, Jatamamsi Tela, Pratimarshanasya. Jatamamsi Tela, Pratimarshanasya, then Sattva Chikitsa, individual and group counseling, and yoga and pranayama. This is a treatment protocol that we follow in withdrawal treatment. Next is dependent stage. Most easiest stage to manage among the all 3 stages. That is the dependent stage, where the patient will be oriented towards alcohol intake, where the patient will be know the adverse effect of intake. And very important thing is that generally dependence cases, there will be insight in the patient. I have come or I am brought to by in this OPD to quit alcohol. That is very important. That helps us in a very positive way to make him understand or make the patient party understand. In dependent stage, it is very easy. So in dependent stage, oral medications that we do is same Deepanavachana as Panchakola Fanta, Sumukti syrup, that is a drug or a patent drug that has been made in our college. Sumukti syrup as a liver tonic, then Saraswari, these all syrups, Saraswarishta, Shigandaswa, Ashwagandharishta, Panjaravinda Churna, all is to as a liver function promotion. Okay, next is Ashwagandha Churna, the Tura Lavana to prevent cravings, even Arogyavardhani Rasa, Medhyavati and Marsamitravati to pacify the psychological aspects of the patient. Next, Panchakarma treatment, as earlier I had given, we have a treatment protocol that we follow here with Takradhara. If the patient is not comfortable with Takradhara, we even go for Shiropichu. Then Abhyanga Parishega, Udvartana has been given. All general treatments, as I have explained earlier. Even in dependence, if the treatment is prolonged after what we'll say more than 1 month, we can even plan for Basti Chikitsa as a what we'll say rejuvenation therapy. Basti Chikitsa as a rejuvenation or a rehabilitative therapy for alcohol dependence cases. Okay, this is regarding the treatments. Okay, next other treatment that we do in our is psychological counseling. Psychological counseling, it is very important. First of all, we must understand the insight of the patient. What is the insight? Whether the patient is aware of his problems, whether he is ready to quit. Based on this, we plan the psychological counseling. First of all, we do individual counseling for the patient, individual counseling, where we make him understand what all mistakes he have done. First of all, make him realize how was his life before consumption of alcohol, and what all are the changes that has been observed after consumption of alcohol, both familial situations, occupational situation, as well as financial situation. That is very important. As during assessment, I told one point: how much amount do you spend in drinking alcohol? What we do is that we make the patient to calculate. If the patient is taking, for example, you take 80 ml in a day for past 20 years. So we tell the patient to calculate 80 ml, how much is the cost into 20 years. So it will come a huge amount. Based on that, we counsel the patient. Based on that, we counsel the patient, telling that you could have used this for so and so, so and so. So a positive counseling. Another aspect is a negative counseling. There are some patients comes to our OPD telling that I know alcohol is not good, but still I cannot leave it. In that cases, what we do is that we get the USG scanning done. USG scanning done, and generally all these cases will be having hepatomegaly or what you'll say, chronic liver disease, anything might be there. At that time, what we do is that we'll directly tell to the patient that you are having severe severe liver disorders, and you don't have much time. You don't have that. That is a negative counseling that we tell negative that you will not. If you want to survive, or if you want to live for next 20 years, you must quit alcohol. But there is another drawback for that point. You must be very careful. You must assess the patient's mentality before suggesting this point, because some patients have a tendency, they take it in a negative way and say that I have only this many days left, so I'll continue my drinking. That point also must be taken into mind when you counsel the patient. Next, first we do individual counseling, then we go for group counseling. That means group counseling, more than 3 members we will take up, and we'll tell them to share their situation, what all have changed. So they start, as a third person, they started to observe each other. What all there is common in me, or me and the other patient. What all impact has happened in both persons' life, and how we can change. A group discussion will give positive as well as negative ideas to improve the quality of life in an addict. Okay. Then after group counseling, we have familial counseling. That is very important. Familial counseling means there is a very bad situation in the society that as soon as the patient quits alcohol, the demand from the family as well as society increased to an extent that he again become addict. That is very bad system that follows in our society. Is that, for example, as from past 20 years, he was an addict. So nobody was asking about the financial status, how the family is running, or everything is not there, how the children's fees is run, whether children will getting new dress, or how the functions in the houses are done. All that is unknown for him. Nobody asks him. It just goes as it is, as a flow. But as soon as he quits alcohol, family tends to become more demanding. That now you are not drinking. Now you have money with you. You get me this, or you do like this. The family become more demanding. Even the society becomes more demanding. That now you are not an addict, so you can perform well. Why don't you try this? Why don't you try that? That must not happen in life of any addicts, because that is a provocation that can change the mind of patient to become again an addict. Once he have quit, they must give ample time for him to settle back to the society. Then only he will quit alcohol and come back to normalcy. That is psychological counseling. Even after the counseling must not stop once he discharged from the hospital. What we do is that every 15 days, when he come back for follow-up, again we take detailed history, what all changes, social, familial. So we have a mild or a small counseling session to 15-20 minutes, along with the individually group as well as familial counseling. It is very important. What is the positive impact and what's the negative impact of quitting alcohol must be assessed once in 15 days for at least for next 6 months. And we must keep on motivating the patient not to use alcohol. For that, you have Alcohol Anonymous, lot of groups are there. Okay. Next is yoga and meditation. Yoga, as you know, all pranayama or any kind of meditation to stabilize your mind can be given to the patient. So how much ever it is effective, what we have treated means we are treating the patient with yoga and meditation. We have, along with the psychological counseling and treatment, is giving good result. Only yoga and meditation, whether it is giving result, that I am not sure. I have not tried it only with yoga and meditation. So yoga, different kind of therapeutic yoga, based on the physical ailments or any somatic condition is there for the patient. Based on that, yoga and meditation can be planned. Treatment for psychological problem. Here I include is that some patients will be depressed after quitting of alcohol. How I will be accepted to the society? Everybody will look into me as an addict. So in that condition, whether the patient is going to depression or whether the patient is becoming an introvert, those things also must be assessed and proper treatment must be given. Next point is continuing support. That is what I told. The family, the society, as well as a doctor or as a psychiatrist, we must continue to the support to the patient and promote the patient to bring more and more patients so that he can become a leader of these people and he can guide other. Once you make a person an idol, then that person generally, they don't fall back to addiction. Okay. Then as lifestyle and home remedies, I would consider your social situation, develop healthy habits, do things that don't involve alcohol. Next point is coping and support. Next slide, please. Next slide. Coping and support. Many people with alcohol problem, they're, as I have told, many people with alcohol problem and their family members find that participating in support group is an essential part of coping with disease, preventing or dealing with relapses and staying sober. So one more thing I have seen is that one of the de-addiction centers in Thrissur, Kerala, I forgot the name. It was near a dam, Pumala Dam. Yes, there is a ex-military officer who is running this de-addiction center. The speciality of that de-addiction center is that there is no medications. No medication is being used in that center. Only by individual therapies. That means how that it is like a hostel where you stay, you cook, and you clean the premises. I mean, many might have seen in different movies, but it is successful. It is showing a good success rate. Okay, so that is a coping and support. In that way, there it is a 3 months course. That what happens is that 1 month you'll be individually taken up, then next month family will come and join, and last month again individual. So that has given a better result. I feel better result of what you'll say. Relapse of addiction is very less in that case. Relapse of addiction is very less. Okay. In another way we can do is you can give even electroconvulsive therapy for addicts so as to make him fearful, but it must not cause any other physical or psychological ailments. Okay. So these are the next slide, please. Next slide. Next slide. So this is it's a sample treatment protocol that we follow for mild alcoholic disorders. That is, first day we give Sadyavamana. Next, for 5 days we give for Sarvangabhinga with Murchatela and Svetana. Next, Shirobiji with Brahminadela for 7 days. Takradara for 5 days. Ajamoda Arka internally. Sumukti Syrup internally. Yoga Pranayama. Individual and group counseling and even relaxation therapy. So essential for treating an addiction. Proper, next slide, please. Next slide. Okay, essential for treating an addiction. Proper, it includes everything. Okay, this addiction essential for treating not only for alcohol addiction, for any addiction. The best way is proper assessment to understand at which stage is the addiction, whether it is an intoxicated state, whether it is in a withdrawal state, whether it is in a dependent state. Substance use monitoring. This is very important nowadays. Mobile addiction is on a high, so substance use monitoring. Somebody must monitor what is the frequency of usage of addictive substances. Clinical and case management programs. That means that I told you must promote the patient to bring more and more involvement in the de-addiction section. For example, I'm working in SDM, Sri Dharmasthala Ayurveda College. Our management, that is Dharmasthala Trustee Temple, they are having a subsidiary known as SKDRDP, Sri Kshetra Dharmasthala Rural Development Program. They are having a vast de-addiction program running in the Hassan district and Indian Darod district, where there are volunteers who bring them patients towards the camps and they get de-addicted, and these de-addicted people get new patients, And they do a very beautiful thing is that once in a month, they will have a meeting, once in a month or twice in a month. And they, what you'll say, appreciate these people. They call them upon the stage for quitting alcohol. They'll be rewarded with a lot of certificates, everything. That motivation helps the patient to bring new patients or new persons into the system, as well as not to consume alcohol. They are even given cadres, like in what you'll say, army, you will get cadres, like from what you'll say, normal sepoy till lieutenant colonel, that like that cadre is given for the people, so that it is like a motivation, so as to bring more and more people, more and more addicts into the camp, so as to de-addict the people. Next is educational and orientation services. There is another one more point which is running is under our college, and with the in coordination with Ayush, a new project has been started in one of the Chandrapatna, that is a place in Hassan district in Karnataka, where we are doing de-addiction camp for next 3 years. It's a de-addiction program or a de-addiction project sanctioned by the Ayush, which worth around 1.4 crore rupees. This is conducted in coordination with our college as well as the Ayush department. We are conducting de-addiction camps on a daily basis. We have selected Chandrapatna one taluk, where there is maximum addiction in the district, and we are concentrating in this district by proper counseling and admission, as well as by OPD basis treatment, how much we can help or promote the persons to quit alcohol. That is educational and orientation services, proper mental health services, familial support and care, vocational supports. That is very important. After quitting of alcohol, going back and getting accepted to the society and getting a financial support is very difficult. So there can be opportunities to get a good job, or suggesting some places where such people will be accepted as a normal person must be suggested to the individual after de-addiction. Then recovery support program. Recovery support program, as I told earlier, camps can be de-addicted camp, or there is a group known as Alcoholic Anonymous, where a group of people who have de-addicted from alcohol come together to share their experiences after de-addiction, what they are experiencing. That is Alcohol Anonymous. That is a group of people. That is a recovery support programs. Social acceptance and support, that we cannot create, but we can create an orientation in the society regarding the de-addicted people, so that they can be easily accepted back to the society with proper support. Concluded remark: addiction is a disease that makes people too selfish to see the havoc they have created, and de-addiction is a realization that it's time to care about the people whose lives they have shattered. Thank you very much for your patient listening. I hope I have imparted some knowledge regarding Madatyaya and its management. Thank you very much. Any doubts?
Thank you, sir. Now we'll be moving on to the question and answer session.
Sure.
You can post the questions in the chat box.
Somebody has asked about that military person's address. Actually, I don't know the address exactly. I have heard about him. I have met him once when I was meeting the deputy collector of Thrissur, when I was working in Thrissur as a special medical officer. His name is Joseph or something like that. So it is near the Pumala Dam. Dam is there. Dam facility is there. Near to that, this de-addiction center, very commonly known in that area. So if it is, I think 2-3 newspapers has also reported regarding this de-addiction center. If you go through that, you will get this name of de-addiction center. I exactly don't know. I don't know there is a specific name also. If you go through the internet, you will get a lot of details about it. I think its name is around Joseph. He was an addict and he quitted alcohol, and he has made this group. So it's a very good and genuine area to get de-addicted. Okay, any more questions?
Thank you, sir. So there is another question.
Line of treatment if patient is also addicted to smoking. See, addicted to smoking, generally it is more difficult to make the patient quit than alcohol. Why? The craving towards smoking is very high. For example, you quit the smoking for 10 days. 11th day, you are standing in a bus stop and somebody is smoking near you. Okay, that smoke, once you smell, the person will get a tendency to take at least one puff or at least one time. That again leads to addiction. So smoking, controlling smoking is very difficult, as the social platform, social platform, you can say. In public, if the smoking is like, in public, we cannot consume alcohol. It is against the law. Similarly, if it is coming to smoking, publicly smoking is banned. That means, you can tell that smoking can be similarly, treated. Similarly treated or similarly de-addicted. Next point is that diet plan. As such as in smoking, what I have felt is that it is that heat that goes into the lungs or heat that enters our body that is giving a satisfaction for the patient. So you can alternate the patient with other heating objects. For example, what we can do is that you can give him hot water, okay, or you can tell the patient to take Dhumavarti. Dhumavarti also gives same smoke only, but it is a medicated smoke. Even that is also a problem. If you tell the patient to take the Dhumavarti, again, that must not become an addiction. That is also a very drawback of this. Okay, so smoking, I don't think so. De-addiction is pretty difficult. Only the willpower of the patient will help to quit smoking. Diet plan, as is, there is no much diet plan. Diet is not much related to smoking. Alcohol means I could have told, something liver improvement diet plan we can banish. For smoking, I don't know. To quit smoking, no. Any more question?
Thank you, sir.
One more question comes, whether the treatment program for de-addiction is free. In our hospital, it is not free, but the program which is conducting in Ayush, in coordination with Ayush in Chandrapatna, in Hassan district, it is completely free. All consultation, medicine, admission, everything is completely free. 7 days of treatment is a plan, and everything is free for the patient. Nothing will be charged. Patient having liver cirrhosis, 40% liver damage will be benefited. Absolutely, 40%, then not at all any problem. If the patient is being, there is a doctor, and most of them will be knowing Samir Naik sir. Samir Naik sir of Belgaum. Sir was treating, Udara, Jalodara, or any kind of ascites using our line of treatment. He used to treat it with the Bandhana line of method instead of tapping. Generally, when you come for ascites situation, what happens is that tapping is a line of treatment, where he had used some other line of treatment, where he has started to give mild diuretics. Along with that, he used to do bandhana, tight bandaging, draping of kora cloth around the abdomen and giving mild diuretics, so that the excessive water will be moved out. Okay, that even this 40% is not big deal. We can cure the disease with the proper assessment. And at least the problem is that we must have at least once in 3 months, you must have the USG done. What are the improvements that we are seeing? That must be assessed. If it is not affecting properly, you must change the line of treatment, because sometimes all liver function test improving medicines will not act properly, as there is liver cirrhosis. There is benefit of our treatment in liver cirrhosis, that is guaranteed.
Thank you so much.
Should the patient be allowed to drink or smoke in small quantity till the treatment goes on reduce? That is a misconception that we follows. See, gradually there is one more thing. In Charaka, Susha, they have told to give reduced quantity. Instead of that, what we can plan is that if you give a little quantity also, still they are addicts only. They are not coming out of that addiction. If you are giving 10 ml of alcohol also, still they are in addiction. They are not coming out of that. Craving is being pacified. Craving is not being pacified properly. So what happens is that only alcohol, this only thing that we can do is that you can alternate it with some other thing. For example, as I have told, Kharjura di Manta or any kind of juices which give little bit of that fermented effect, that can be alternated for this thing. What you'll say, for giving. Instead of Madhya, you can opt for that. Punarjani Charitable Trust. Yes, Dr. John. Don't feel he's not a doctor. I think that is a Punarjani Charitable Trust. I am not sure name. If you get me, I'll give my contact number. You can get me. I'll try to find it on YouTube. The through Levana preparation also, I am not I have used it. I'm not so expertise in that preparation. I'm very sorry with that. I'll get back to you. If you want me, you can just text me. I'll get back to you with the preparation. Yeah, might be. He is ex-military person. I'm not sure about that guy. I have seen him. He's a very simple guy, very normal guy. I have seen him and I have spoken with him. I don't know much detail about that guy. There is, which is functioning very good.
Thank you, sir. So there is another question.
Please explain the treatment protocol in acute alcohol hangover related condition. See, there is no acute alcohol hangover. That is acute withdrawal. It is not hangover. It is withdrawal. It's not even withdrawal. We cannot say it as withdrawal also. It is that best way to treat hangover is to drink buttermilk. If you want to come out of acute alcohol hangover, drink buttermilk, or you can go for lime juice. That is the best and easiest way to manage that. Okay. Treatment protocol, once that alcohol effect is reduced, once the alcohol effect or the impact of alcohol in the bloodstream is reduced, automatically the hangover will be gone. And another one more point is, which all are the symptoms that you get in hangover? Whether it is the dizziness, whether it is headache, or whether it is heaviness, all those must be considered. And you can treat according to the symptom that is being seen by the patient. Okay, that will be more helpful. No need of any particular treatment protocol for that. It is just momentary. Alcohol hangover is late momentary. If it is withdrawal, when it is coming to withdrawal, then fine. After treatment, what about the chances of relapsing? That is a very, very difficult question to answer, because that is not in our hand. So far, we can orient the patient and patient family as well as the society about Madatyaya, but we cannot go behind the patient, convincing the patient every time. When you see the patient, you can't convince him not to consume alcohol. That is left to the patient. That is these 15 days or 28 days that we get in our hand. That is our chance to make him understand alcohol is not good to your body. You must not touch it again, because it is not at all good to you. That is, these 28 days is a chance that patient has given us to convince him why I must not take alcohol. And if you are able to convince him that you must not take alcohol, you are successful in your treatment. Okay. But even the question of relapse, that is a great question mark even for me, because until now, how many Madatyaya cases I have treated, only 25% doesn't have relapse. Rest 75% of them had relapse. I must be genuine and true to you, because that is a social situations or how he manages. That is very important. Sir, does Vidarigandha Churna is useful? I have not used it. I have heard about it. Might be. Let me see if I get a chance. Can you suggest me with any kind of pharmacies that use Vidarigandha Churna? You can suggest me. I'll try it and I'll let you know about it. Expenses for your hospital for 28 days, that depends on which ward you take. There are different varieties from premium category till the general ward. Different category you take. So based on that, the treatment chart will change. And if you are coming through the program, means through the de-addiction program from Chandrayapatna, means that is free for you, you will get the general ward. So expense, I cannot exactly tell you. Approximately, if you are taking up general ward, it will take around 10 to 12,000 for 15 days. 28 days might around 20,000. If you are in general ward. When you go to upper wards, which is more costlier, like 3 sharing or 5 sharing, again the money or the charges will increase. As the facilities increases, the charges also increases. Okay, so exact expense I cannot tell you. I cannot judge it, because individually also it is very difficult. We give different kind of medications, we do different kind of treatment. So we follow a protocol, but it keeps on changing. Yeah, no, I'm not that much sure about it. When coming to Arka, I'm not much sure about it. Koshtagadavata.
Thank you so much, sir.
Yes. Any more questions? For cigarette de-addiction, any help? Only one help is control yourself. Keep away or keep social distancing from smokers. That is the best way. Try to treatment as such, there is no treatment. And another one more thing I would like to tell you is that I have seen people using Surari as well as Dhumari. Surari and Dhumari. That also I must inform you. That is a Rajasthan pharmacy product, Surari and Dhumari. Surari is for drinks, as Dhumari is for smoke. I don't know what are the ingredients of that drugs, but that has given good result. That has given good result, both for Dhumari as well as Surari. That has prevented relapse. Generally, what we say, no, we see to in as soon as we open our Airtel or Videocon D2H, one lady will be coming and speaking about de-addiction. This one powder had been given here, complete liquid. It is something like that. I have seen Ayurvedic doctors practicing that. Surari and Dhumari. Surari is a drug which we get for 1,500 rupees a packet, which is having 15 sachets. Where what happens is that drug is mixed with the food and given to the patient. As soon as, if there is any alcohol content in the body of the patient, as soon as you intake the food which is mixed with the Surari, he started to feel giddiness. He will have severe headache, everything. And finally he vomits. Same in case of Dhumari, what happens is that it is of Rajasthan Pharma. Dhumari, if you take Dhumari and if you try to smoke, you will get severe headache, like migraine. And there will be drastic watering of eyes as well as reddishness of eyes. That has been, I have seen people using that. I have not used it because I am not sure of the ingredients, whether there is any kind of steroids. They say that it is a mix of Siddha, Ayurveda and Unani. I don't know. They have not given correct ingredients in that. In that packet which they give the ingredients, that they have not mentioned it properly. So I don't know about it, but I have seen doctors practicing it and getting good result. I'll tell you once again, the drug's name is Surari and Dhumari. Any more questions? Any more questions?
Delegates can post your questions in the chat box. Sir, Dr. Suryanarayan has raised his hand, sir. Can I allow him to speak, sir?
Yeah, sure.
Okay, sir, you can ask, sir.
Doctor,
Yes,
good
sir.
evening.
Good evening, sir.
Sir, in generally, youth also consuming more alcohol. Sometimes whoever dose they take, they will get tetany. Then immediately what we will do?
If they, what is the situation of the patient when the patient is getting too much giddiness or they are like unconscious state, right?
Okay.
Yeah, in unconscious state, you can primarily you can go with DNS or IV. Okay, so that he must regain strength, because if you induce any kind of food items, there are chances of vomiting. So that will be of no use. You can go for DNS oral 1 ampule for slowly you must give 1 ampule. So that can be given, and even if there is any gastric irritations, manage accordingly. And if you want to come out of the hangover, best way is to give non-fermented buttermilk. Non-fermented, not much fermented. That sour taste must not be there. Freshly prepared buttermilk. That is very good.
Okay.
Have you treated drug addiction?
Yes. Doctor, one more doubt.
Yes.
Alcohol induced headache. How do we treat?
Until and unless the content of alcohol does not come out, headache will not pacify. It's very difficult.
Okay.
It's very difficult. That is the best way to do is mild Sadhya Vamana can be given for the patient. That reduces the headache very fast.
Acha. Very nice.
Yes.
Okay, doctor. Thank you.
Yes. Thank you, sir.
Okay.
Have you treated drug addiction? Drug addictions I have tried, but I have not got much result, because drug addiction definitely requires cell. Because we must forcefully abstain the patient from consumption. Drug is more gross than alcohol. Drug gives very immediate impact. That means even alcohol, if you skip for 1 day, it does not cause withdrawal. But drugs, if you skip for 1 hour, it will cause withdrawal. So drug consumption is very gross. You must have a cell or a chain system if you want to do drug addiction. They are more aggressive than alcohol addicts. I have tried, but I'm not been that much successful. And they're very intelligent. They try to skip our treatment and tend to take drugs. I have not got much prognosis in treating drug addiction. Any more questions?
Sir, there is another question, sir.
Okay.
Sir, will Yeshtimadu
Yeah, I got it right.
Oh.
No, it is not. Yeshtimadu Kshirapaka doesn't cause vomiting. No, Yeshtimadu Kshirapaka doesn't cause. We are not giving in so much quantity. Yeshtimadu Kshirapaka maximum of 40 ml, maximum of 30 to 40 ml only will give. Not as that, it will not induce vomiting. It will not induce vomiting. No. If the patient is feeling dizzy about it, it's fine, no problem. But still, that reduces the withdrawal symptoms. Yeshtimadu Kshirapaka, it has been seen very useful in reducing withdrawal symptoms. No, it doesn't cause any kind of vomiting. Timing as such, morning and evening, before food only we prefer. Kumari Asava, generally, when there is, generally when the patient comes to our OPD, there will be gastric problems. So preferably no. I have not used it. No.
Thank you, sir.
Yes. Alcohol, fatty liver, same line of treatment protocol you can follow. Not at all an issue. Same protocol, fatty liver, that fatty liver, alcohol-induced fatty liver is very easily, we have good prognosis, up to 80% we can cure. For tremors in alcoholic, chronic alcoholism, tremors is a part of withdrawal symptom. Or it can lead to, or tremors is also a symptom of chronic dependence. Only complete line of treatment, even after basti, only tremors may reduce. Whether the tremors is due to any other physical somatic illness also must be checked. Due to excessive alcoholism, neurodegeneration can happen, leading to tremors. If that is a condition, if there is a neurodegeneration in the patient due to alcohol intoxication, then treatment of tremors will be very difficult for us. The prognosis will be less. If the tremors is due to alcohol craving, we can treat it. If it is coming because of withdrawal, means we have 100% prognosis. That will reduce. That will reduce by around 80%. But if it is due to any neurodegenerative conditions due to alcoholism, then it is difficult to treat. You must see what has happened. Based on that, you must treat the patient. Any more questions? Yes, please.
Delegates can post your questions in the chat box. Sir, there are no more questions, sir.
Okay, fine.
Conclude this session.
Sure.
Thank you so much, sir. Thank you for taking your time to patiently answer all the questions, sir.
Yes, sure.
Now we'll be moving on to the vote of thanks.
Thank you, sir. Now I invite Dr. Neetu ma'am, Associate Professor, Department of Kaya Chikitsa, Ayurveda College, Coimbatore, to deliver the vote of thanks. Ma'am, over to you, ma'am.
Thank you. So good evening, one and all. So on behalf of Ayurveda College, Coimbatore and Team DIKSHA, it is my privilege and a great joy for me to extend a vote of thanks for today's session. I would like to express my sincere gratitude to Dr. Vinay Shankar, sir.
Thank you.
For sharing your valuable experience and views on this Madatyaya and its management. It was very knowledgeable, sir. Thank you for enlightening us with this knowledge of its Chikitsa, and it boosted our confidence actually for taking up such cases. And also thank you for patiently answering all the queries raised by the delegates. And thank you once more, sir. And,
thank you very much.
I extend my sincere gratitude to the whole DIKSHA team for providing us with the best virtual platform. And last but not the least, let me thank all our delegates who have responded so well to make the session a successful one. And we look forward to welcome you again in our coming sections. And thank you once again. Thank you. Thank you, sir.
Sure. Thank you, everybody.
Sir,
Thank you for this
could we get your number, sir? Could we please get your
sure.
phone number, sir?
Sure. 8075 378 521. Got the number? 8075 378 521.
8075.
378
Yes, 521.
521. Yeah.
Thank you so much.
Yeah, sure. Thank you, one and all. Thank you for this opportunity to share my experiences. And thank you, everybody, for your patient listening. Thank you.
Thank you so much, sir. No matter how chaotic the world gets, maintaining your inner peace is the top priority. Stay healthy, stay safe. Thank you all for patiently listening and for the valuable time spent. See you all in the next session. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.